Hi, I'm Dr. Julie Steinauer. In this video, I'm going to talk to you about poor comprehension, but not just where it may come from. What do we actually do to correct the problems with vision that could potentially cause poor comprehension? Now, if you want to connect with us and you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You've got two options. You can either click the schedule a consultation button, and you can also you can fill out the questionnaire that's on there. Now, those are for non-local people. Yes, we do work with people from all over the world, and we help manage what could potentially be done to help you with your doctors. So contact us. All right, now let's talk about poor comprehension. We discussed that in another video, and now I want to talk about not just what causes it, but how do we actually treat it? Okay, so poor comprehension, as we discussed in another video, can come from tracking problems, misalignment or strabismus of the eyes, poorly working eyes together, which is a binocular vision disorder, suppression of an eye, and there's other things, word guessing we mentioned. Okay, but how do we fix it? Let's talk about that. So the first thing that we utilize, we've discussed a lot, Syntonics. You know, this is one of my favorite things ever. All right, but Syntonics filters, what they do when kids wear them or adults is that it triggers the brain electrically to create new connections. It may increase the brain's ability to connect and decipher information, and so it helps a person with processing. It may increase blood flow or turn blood flow on to a specific area of the brain. It actually just helps develop the brain overall and speed up development. So if someone maybe is even behind with reading, these glasses electrically kind of speed up the brain's ability to develop and process visual information, and really any information, whether it be visual or auditory. Now, there's a secondary component to what we do. So it's not just about the electrical stuff. You can't just wear goggles and everything's fixed. Okay, it is part of a system or part of a program. And so the electric phase, or kind of, we call electric connection phase, and then there's more of a motor phase or more of a mechanical phase. And in this phase, this is considered traditional vision therapy, where we are training maybe each eye individual to track well, to line up, to focus well, and then we put them together so that they can line up well together and can be used efficiently as a team. So that when you are reading or when your child is reading, you don't have an eye turning up or out, you don't have the brain turning an eye off or suppressing, and you have the ability to stay focused on the words long enough that you don't just word guess, but you can be accurate because your eye movements are now accurate after we've trained them. So again, we train them kind of electrically by telling the brain what to do with processing vision, and then more mechanically or a motor kind of component. Those two things together help our office to achieve improvement with comprehension and reading skills for our kids. In fact, they jump anywhere from 3 to 7 grade levels above where they entered in at, which is pretty awesome. And we love to see these types of results. So if you or your child happens to have some problems with reading comprehension and you want to connect with us, call us if you're local at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and either schedule a consultation direct to talk with me, or click on the questionnaire button and fill out the questionnaire so we can begin discussing things with you. Now, if you like the video, hit like. If you've not done so, subscribe to our YouTube channel. Pass it on to others, please, and thank you.